Hello, everyone. In today's session, we'll explore how health promotion intersects with resilience in American Indian communities. We'll identify what makes programs effective, discuss strategies for supporting culturally rooted initiatives, and celebrate the incredible strengths that have allowed these communities to thrive despite historical and ongoing challenges. Let's begin. The objectives for today's session are to identify features of effective Indigenous health promotion and general practice programs. Describe how to support evidence-based, culturally rooted health promotion and disease prevention initiatives in clinical and community contexts. Recognize and promote the ways American Indian communities have maintained health and wellness despite ongoing challenges. And celebrate and support the resilience and strength of these communities. Let's start by defining two key concepts: health promotion and resilience. Health promotion is about empowering individuals and communities to take control of their well-being. It's not just about treating illness, it's about preventing disease, fostering healthy behaviors, and creating environments that support wellness. Resilience, on the other hand, is the ability to adapt, thrive, and maintain wellness despite adversity. For American Indian Alaska Native communities, resilience isn't just a personal trait, it's a collective strength rooted in culture, tradition, and community. So why is this necessary? To address historical trauma, systemic inequities, and ongoing health disparities, while empowering American Indian and Alaska Native communities to reclaim their well-being through culturally rooted solutions. By blending traditional wisdom with modern approaches, we can create health promotion programs that are both effective and culturally relevant. Let's explore what makes these programs successful. What makes an Indigenous health promotion program effective? Effective Indigenous health promotion programs share several key features. Let's break them down one by one. First, community-led initiatives are critical. When programs are designed and implemented by the community, they reflect local needs and priorities. This ensures relevance and sustainability. For example, a diabetes prevention program might incorporate traditional foods and activities that resonate with the community. Second, cultural integration is essential. Programs that incorporate ceremonies, storytelling, and traditional healing methods are more meaningful and accessible. For instance, a smudging ceremony might be used to reduce stress and promote mental health. Third, a holistic approach addresses physical, mental, emotional, and spiritual well-being. In many Indigenous cultures, health isn't just about the body, it's about balance and harmony in all aspects of life. Fourth, evidence-based practices combine modern science with Indigenous knowledge. For example, epidemiological data might be paired with traditional ecological knowledge to address environmental health risks. Finally, collaboration is key. Successful programs involve partnerships between healthcare providers, tribal leaders, and community members. These relationships ensure that everyone's voice is heard and that solutions are co-created. Together, these features create programs that are not only effective, but also culturally appropriate and sustainable. To support evidence-based, culturally rooted initiatives, we must take a thoughtful and respectful approach. Here's how. First, understand the cultural context of the community you're serving. This means learning about their traditions, beliefs, and priorities. For example, if a community places a high value on storytelling, consider using narratives to communicate health messages. Second, use data to inform decisions, but always respect Indigenous knowledge systems. Data is important, but it should complement, not overshadow, traditional wisdom. For instance, combining epidemiological data with traditional ecological knowledge can lead to innovative solutions, such as sustainable food systems. Third, tailor interventions to align with community values and traditions. Instead of imposing Western models, adapt programs to fit the community's unique needs. For example, instead of promoting gym memberships, encourage activities like dancing, which may already be part of cultural practices. Finally, build trust through respectful partnerships and ongoing engagement. Trust doesn't happen overnight. It requires consistency, transparency, and mutual respect. Show up regularly, listen actively, and prioritize relationships over outcomes. By taking these steps, we can create initiatives that are both evidence-based and culturally rooted. The following practices contribute to obtaining and maintaining health in Indigenous communities. Traditional healing practices play a vital role. Herbal medicine, ceremonies, and spiritual rituals continue to promote health and well-being. For example, sage burning or sweat lodge ceremonies can reduce stress and foster spiritual connection. Community connections are a cornerstone of resilience. Strong social networks provide emotional support, foster belonging, and create a sense of purpose. These connections remind individuals that they're not alone in facing challenges. Land stewardship is central to wellness. Many Indigenous peoples view themselves as stewards of the earth, drawing strength from their connection to ancestral lands. Activities like gardening, hunting, or fishing not only sustain life, but also reinforce cultural identity. Storytelling has been a powerful tool for preserving knowledge and inspiring resilience. Through stories, elders pass down lessons about overcoming challenges, maintaining hope, and celebrating victories. These traditions remind us of the enduring strength of American Indian and Alaska Native communities. By recognizing and promoting these practices, we can support health and wellness in these communities. It's important to celebrate the resilience and strength of American Indian communities. Let's highlight some examples. First, language revitalization is a powerful act of cultural preservation. Many tribes are reclaiming their languages through classes, apps, and immersion programs. This not only preserves heritage, but also strengthens identity and self-worth. Second, advocacy efforts demonstrate the power of collective action. Tribes are leading movements for environmental justice, renewable energy, and policy changes that benefit their communities. Third, we should recognize achievements in areas like education, healthcare, and environmental justice. For example, some tribes are implementing innovative telehealth programs to address geographic barriers to care. Others are leading renewable energy projects that benefit both their communities and the planet. Finally, foster pride in cultural heritage and accomplishments. By celebrating these strengths, we affirm the value of Indigenous knowledge and inspire hope for the future. Celebration isn't just about recognition, it's about empowerment. By amplifying Indigenous voices and successes, we can inspire others to join the movement for health equity and cultural preservation. To summarize, today we explored how health promotion and resilience intersect in American Indian and Alaska Native communities. Health promotion isn't just about treating illness, it's about empowering communities to take control of their well-being while honoring cultural traditions. At the heart of this is resilience, a collective strength rooted in culture, tradition, and community connections that has allowed Indigenous communities to thrive despite centuries of adversity. We identified what makes Indigenous health promotion programs effective. They are community-led, culturally integrated, holistic, evidence-based, and collaborative. These programs honor the unique needs and values of each community while addressing contemporary health challenges. We also discussed how American Indian Alaska Native communities maintain health and wellness through tools like traditional healing practices, strong social networks, land stewardship, and storytelling. These practices are not only vital for promoting resilience, but also for preserving cultural identity. Finally, celebrating resilience amplifies Indigenous voices and successes, affirming the value of Indigenous knowledge and inspiring hope for the future. By recognizing these strengths, we can work together to build healthier, more equitable communities. Now it's time to take action. As allies and advocates, we can commit to learning about and supporting Indigenous health promotion initiatives. Take the time to understand the cultural context of the communities you serve. Attend workshops, read literature, and listen to Indigenous voices. To help you get started, I've included a list of valuable resources on this slide, such as the National Indian Health Board, CDC Tribal Health Resources, and the Indian Health Service. Partner with tribal communities to co-create programs that honor their values and priorities. Collaboration ensures that solutions are culturally appropriate and sustainable. Advocate for policies that address health disparities and promote equity. Push for funding, resources, and systemic changes that benefit Indigenous communities. Organizations like the Native American Rights Fund and First Nations Development Institute are great places to start. Celebrate resilience by amplifying Indigenous voices and successes. Share stories of triumph, attend cultural events, and support initiatives led by the community. Together, we can build a future where every individual thrives. Take the time to dive deeper into the cultural context, priorities, and needs of the communities you serve. To help you get started, here are some valuable resources. The National Indian Health Board, NIHB, is an organization that advocates for the healthcare needs of American Indian and Alaska Native communities. Their website provides policy updates, toolkits, and advocacy opportunities. The Centers for Disease Control and Prevention, CDC, has a dedicated section on tribal health. This includes data, research, and best practices for addressing health disparities in Indigenous communities. The Indian Health Service, IHS, offers a wealth of information on community health programs, funding opportunities, and partnerships. Their website is an excellent resource for understanding the healthcare landscape in tribal communities. Remember, change starts with small, intentional steps. Whether you're a healthcare provider, policymaker, or a community member, there's a role for everyone to play. Thank you for your dedication to this vital work. Here are our references. Thank you for listening to this presentation.